Hi, I'm Dr. Harish KV. Heart failure is not stopping of heart, but the heart fails to pump enough amount of blood to the periphery of the body. This is called heart failure. Heart failure is usually seen in certain conditions like high blood pressure, diabetes, cardiomyopathy, heart attacks, valvular heart diseases, and also congenital heart diseases, hyperthyrotoxicosis, that is hyperthyroid state, and increased stress cardiomyopathy is also one of the common conditions that we see in nowadays. I would always wish general population and patients follow a healthy diet which is low of salt, quit smoking, keep their alcohol to minimal, add on regular exercise, meditation and yoga, keep their blood pressure under good control, diabetes under good control, get their yearly health checkups done, and in case of any heart issues or any health issues, meet a physician and then take some investigations which are required and conclude the diagnosis and try to lead a stress-free life. Heart failure are of different types. So based on the type of heart failure is of systolic heart failure and diastolic heart failure. Based on what condition it is, whether it is a cardiomyopathy or is it because of an uncontrolled hypertension or is because of a diabetes or is it because of thyrotoxicosis or is it pregnancy induced. So there's a lot of conditions. Based on that, heart failure can definitely be treated. There are beta blockers which we use to manage heart failures. There's also anti-arrhythmic drugs which we use for heart failures. We also use pacemakers, cardiac synchronization therapies, left ventricular assisted device. We also do RF ablation, so forth. There are also few cardiac procedures that are done by correcting the valve defects and septal defects. So these are some of the surgeries and interventions that will help in managing heart failures and get a better outcome of it. Yes, you can recover from heart failure. There's a lot of very good medications that have come to treat heart failure and heart failure conditions as well. So definitely yes, failure is treated well. It is not how long you live with heart failure, it is the quality of life and the recurrent admissions that happen due to heart failure that has to be taken into account and treated well. So it is the quality of life. So there's a lot of medical line of management like medications that treat heart failure and also surgical procedures that help in corrections, and there's also assisted devices like pacemakers, cardiac resynchronization therapy, left ventricular assisted device, pacemakers, which also play a part in treating heart failure. Yes, people can live a normal life with good quality of life with heart failure as long as the heart failure is well treated and managed. The specialists who are good in heart failure management, and also there are heart failure clinics which you should visit regularly in case you are suffering in heart failure condition. Heart palpitations are basically throbbing of heart or an abnormal heartbeat, which could be also an extra heartbeat or a missed heartbeat, is called palpitation of the heart. Palpitations of the heart are nowadays seen very commonly because of stress. Stress is one of the major causes for heart palpitation. Caffeine, high intake of caffeine, amphetamine, that is tea, and also high intake of alcohol, smoking, lack of exercise, sedentary lifestyle, thyroid diseases, congenital heart diseases, valvular heart diseases, post-heart attack, coronary artery diseases. These are some of the causes which can also cause heart palpitation. Heart palpitation does not mean it is heart failure. So there are very common symptoms which can be well treated with just correction of our daily dietary intake or our management of stress. They definitely do not mean heart failure per se. If you have heart palpitations, just see that you bring down your caffeine intake, coffee and tea intake, reduce smoking, reduce alcohol. If you feel palpitation is causing lightheadedness or you become unconscious or any episodes like that, if there is chest pain, it is wise to get into a regular physician, get a consultation done and go through the procedure or investigation, whatever your doctor advises, to rule out what type of palpitation it is and why is it occurring. An irregular heart rate does not mean it can cause an heart failure. It's also based on the conditions. As you told you before, a valvular heart disease can also lead to a heart failure at a later stage. So just having an irregular heartbeat does not mean it is heart failure. Irregular heartbeats, if they persist for longer duration, causing symptoms like lightheadedness or breathing difficulties or chest pain, or if it keeps you uncomfortable for longer time, then please meet your physician, take an opinion, follow the advice given, follow the investigations you are asked for, see that you complete them and report to your doctor so that they can diagnose why the irregular heart rate is and it can be treated and managed. Heart arrhythmias are when your heart rate is above 100 beats per minute. These are called tachyarrhythmias. And if there is a heart rate which is below 60 beats per minute, it is called bradyarrhythmias. So these are the two types of arrhythmia which is related to cardiac problems. These are best analyzed first to find whether what type of arrhythmias it is, and then they are managed with beta blockers. They are also given blood thinners, and you do certain procedures called as RF ablations. Pacemakers are there. These are some of the procedures that are done. Yes, once the cause of heart arrhythmias is known, it becomes that easy to treat it with medicines or with surgical procedures. Definitely, yes, heart arrhythmias can be treated. Atrial fibrillation sometimes are related to heart failures, so the best way is to treat them with beta blockers, and there's also surgical procedures that are done to bring atrial fibrillation under control and manage it.